preparing the dental treatment room. Okay, remember the first thing you're going to be doing is reviewing the patient's medical and dental chart, taking out the latest x-rays for the dentist. Okay, then you're going to make sure to wash your hands. As Ms. Gonzalez is washing her hands, I'm just going to go ahead and zoom in over here to remind you that you're going to turn on both the view box and the light. And there is a little light switch on the light. And if it doesn't turn on right away, the only thing that you have to do is there is a little auxiliary light over there that you would turn on in the entire unit. Sometimes that gets turned off instead of the little switch that is on the light. Okay, and you put your barriers on. So next is to put the barriers on. You're going to put on your gloves. Okay. Okay, the barriers that Ms. Gonzalez is using here are the little sticky barriers. And notice that she leaves them, as she takes one, she leaves the other piece stuck down to the canister so that it doesn't roll back in. Okay, and she's just going to be touching putting barriers on any possible surfaces that you or the doctor may be using. She did put some on the handles. Sometimes those stick and sometimes those don't. So you're just going to be very, cautious to see what actually closes and actually sticks. Okay. Next, she's also putting the barrier on the tube head. What else are you doing here, Ms. Gonzalez? Hold on one second. Let's see what you did. So you put one on the control panel.
The control panel.
And then the exposure button. The off and on.
Mm-hmm.
Okay. So we need one there. And then the exposure button, which is going to be here on the clinical side, is going to be here under the cabinet. And we'll see if we can zoom in for you there. We'll do that in just a minute. Okay, she's placing a barrier on the mouse. Make sure not to cover the contacts when you guys put barriers on the keyboard or the mouse so that they keep charging. She's going to put it on the switch, which is going to be the high intensity and the regular switch. Okay. And remember how we talked about how you want to fold part of the seam so that it's easy to get off after? Okay. Closes the cabinets to make sure that no one gets hit on the way to get the rest of the barriers. Okay, the barriers are going to be located for the ones that you don't have in the room. The rest of the barriers are going to be right over here on the laid out on the cabinet. And as she gets her scissors, she's getting ready to get the tubing. Again, notice that she pulls out, she cuts and still leaves a piece hanging out so that it doesn't roll back in. Now, for the comp, you're only going to be asked to put barriers on one of the hoses just so that we know you know what to do. Okay, Ms. Gonzalez, tell me what you're getting as you're getting them.
Okay, I'm getting the light sleeves, the syringe cover, and the tubing. I pre-cut it. And I'm also going to be using the saran wrap.
And you're getting it all at once so you don't have to make as many trips.
Okay, I'll start with the tubing. It's open on both ends, so you just need to pinch it so that you can find the opening. Which is stuck today. See if it opens it up. Oh, it's not opening today.
Okay, well we can move on to the next one and I can, if you hand me that, I can see if I can open it for you over here. How about the other one? Is the other one from the different box?
No, it's from the same one.
The same one?
I will put the light handles on. We do have two sides. For this exercise, I'll put two, one for the dentist, one for the assistant, to be able to do the light handle, lift it up. And we have a small little barrier that we can use on our light.
What else could that be used on?
This could be used on a pen or pencil. We can place it on the pencil end. And then just roll it down so that when we need to make a indication, it's got the barrier. So it can be used on the pencil or on the tip. And here's our hosing that we just bring down. Slide it down. And then we would go ahead and get our tray.
So, hold on one second, Ms. Gonzalez. If you show them how to put the suction tip in there.
Right, which I have on my tray.
Okay.
Place that on there. I'm covering the top. I have my preset tray. I'm going to put the HVE tip.
And she has the plastic covering it. There you go. Because that's the only way these kind of tubings will really stay in. Then you push it through.
That's one way to do it. You can open up your airwire syringe tip that's been sterilized and place it. This is the tip that it goes into. Cover it so we know that it's a new one.
And we have the barrier for that one, correct?
Right. We can do it that way, or we can use a small barrier. another way that we can put a barrier on. A small syringe cover, again, leaving it closed. And this is for the saliva ejector.
And there are also those that have the pre-cut slits already, correct?
Right.
Okay. Do we need one more for the,
Yes.
okay,
But we could do saran wrap.
okay.
Doesn't cut, then we'll just use scissors.
It's important to always have option B ready.
So we can use a tube covering, we can use saran wrap. It would still be the same method of covering this. Come down. It does stick. I don't think we'll need the tape, but leave enough to gather it around.
And notice that Ms. Gonzalez is leaving her thumb right where the
Control is
the
at.
control is, because what she's doing is she's leaving a little bit of space so that she still has access to controlling the suction.
Covering the top, again, we can go right straight through there. Making sure that we can go up and down. So, there's 3 methods right there. Okay. Next.
And once again, you would put one on the, you would put a barrier on the air and water handle, because you want to make sure that all the barriers are done there.
So before you place this, you could very easily have gone and put the barrier. And then put that through there. And you can still have your control. So this completes this station and that.
Okay, and then Ms. Gonzalez puts away all her, she's going to put back all her extra barriers so that others could use it if they needed it, okay? She's going to get the chair cover, the head cover, and the last thing, which she already has out, she already has prepared, is her PPE that she's going to be using.
You can open it up and look for the side that has the grip.
The little shoulders.
Right.
You notice that Ms. Gonzalez lifted up the headrest so that she could get the barrier, the chair cover over there. She's extending it, she's fixing it, and that's the main thing, guys. It's just one of those that you have to make it work. The barrier is there for protection, and so as long as it is on there and the proper way, then it'll work for you, okay?
We're going to tuck a section of it into the footrest cover, just so it doesn't slip out.
Okay.
When the patient's seat sits down, making sure they have enough room, and then I'll get my headrest cover.
And it's right there for you, Ms. Gonzalez.
This also has a little pleat, so open it up all the way, go over, and make making sure that we can control it. And now you can slip this down so it stays in place for the,
And notice how she tucked it underneath and then she pushed it down? Okay, and again,
that completes it.
she has her PPE over off to the side and she's ready to go. Thank you.